Today we're going to dissect the respiratory system structures in the thoracic cavity. Now we've already done the legwork for the opening of the cavity in the digestive system dissection. So you're already going to see an open cavity, and we're just going to dive right in.
Maybe flip it this way.
Mm-hmm.
Cool.
All right, so as a reminder, we've already gone into the oral cavity, but when we discussed this in the digestive tract, we related this structure, the epiglottis, to its function in the digestive tract. But it also functions in two ways. So this little flap of tissue here, the epiglottis, that my blunt probe is just rested on my blunt probe. That epiglottis, again, is life-saving. In the digestive tract, when you swallow, the epiglottis folds over the opening to the respiratory tract, and that opening is called the glottis. So the epiglottis, epi is on top of, folds over the glottis, the opening to your trachea or your windpipe. It's actually the opening to your larynx or voice box, to protect it and keep food from moving into the respiratory tract so that it continues down the esophagus and not into your airways. Now that epiglottis, once you're done swallowing, recoils and opens and allows the glottis that's open to remain open so that you can continue to breathe. So that epiglottis, once it's recoiled and opened, allows air to transport to the larynx. So I'm going to show you the larynx and dissect a few things out here, including the larynx itself. And again, the larynx, the lay term for the larynx is just your voice box. So it is this upper structure here that I'm surrounding. It's just a widened section. So you can see the trachea here. We've looked at the trachea in the digestive system dissection, but this superior portion here is the larynx. And what I would ask you to do is cut above that and cut out the larynx carefully and separate it from the cavity. So we're going to try to cut out the larynx, but leave behind the trachea. And because we want to do something with the trachea. Let me see if I can pull it. There's some connective tissue that got in my way, but that's all right. I'm just blunt dissecting out. And we'll get a close up of this, but then I will take a picture of this through a dissecting microscope so that we can see it a little bit larger, because it's kind of tough to see. We actually got the epiglottis in there, which is freaking awesome. So you can actually see that down here, that little opening, I accidentally dissected out the epiglottis with it. So I'll get a close-up picture of that as well. But I would ask you to describe that and describe the difference between, which you did last week, or in the dissection for the digestive tract, describe the differences on how you can tell apart the trachea from the esophagus. So those tubes are now isolated from one another and kind of separated a little bit better. So we've got trachea, anterior, esophagus, posterior. And the trachea, again, has several cartilaginous rings. It's called hyaline cartilage that keep the trachea open. So this windpipe, the trachea, is always open. I just stuck my blunt probe down there pretty easily because the tracheal rings of cartilage allow the trachea to remain open at all times so that you can continue to breathe. The esophagus being made of two different types of muscle, one being skeletal muscle in the upper third and smooth muscle in the lower third. And that esophagus, its job is to transport food from the oral cavity and pharynx, or your throat, all the way to the stomach in using a process called peristalsis. Now, again, we've already done the legwork to get into our thoracic cavity by way of dissecting, but you can see here the thoracic cavity organs being the right and left lung that surround, there's the superior lobe of the right lung. Say again?
Come forward a bit.
Yep. The superior lobe of the right lung. There's the middle lobe of the right lung. And the right lung also has an inferior lobe. here. Now the heart is positioned off to the left of the thoracic cavity just a bit, and it's exactly the same in humans. So you see this kind of, the apex, this peak of the heart here, points down inferiorly and laterally towards the left side. So because the heart is positioned in this manner, the right lung has 3 lobes, but the left lung only has 2. In rats, it's slightly different. So we're going to see there is the heart, and in the heart you can see this is a thymus gland that I'm kind of getting out of the way here. The heart has 2 upper chambers, atria, and then the ventricles are down in here. But surrounding that, there's a, it's a little hard to see. There's a superior lobe of the left lung and an inferior lobe of the left lung as well.
Point those out again 1 second.
Yep, sure. We've got the superior lobe of the left lung and an inferior lobe of the left lung. And you actually have, if I can see it, I'm going to try to dissect it out here. So you can see I'm trying to dissect through the lungs so that I'm not damaging the tissue, because I want to do a pretty cool procedure here. So there's left lung and right lung. And there should be a 4th. Little tiny lobe at the bottom. Okay, so it's going to be really hard to see here, but you've got a little teeny tiny flap of a lobe of the right lung down here. So we've got a different number of lobes of the lung in rats than we do in humans. So just like in the digestive tract, there's no gallbladder in rats. Rats have an additional lobe of their lung on the right side. Okay. So the larynx was an instructor check. The trachea and the esophagus. Yeah. So the last thing we're going to do here is now, and this is kind of it, this is a quick dissection, is to show how air makes its way into the lungs and inflates the lungs. This is what I would have you do, is insert, this may take me a minute to get, insert a tube. And sometimes if you take a small cut in the trachea, it helps you get in. And take a tube, basically just kind of try to shove it down the trachea, but then hold it in place. I don't know if you can see this very well. So what I've done is taken a transfer pipette and placed it in the trachea, and I'm going to hold it down in place so that when I push the bulb, you're going to watch here in the lungs and watch them inflate, and it'll give you a good view of how air makes its way to the lungs, and I'll give you a 3 count, and inflates the lungs to get to the point where the lungs are supplying air to the alveoli where gas exchange occurs. So I'm going to do this in 3, 2, 1. Sometimes, if I don't get it in there enough, it didn't work that well. Okay, we're going to give it another go until this can be really frustrating. 3, 2, 1. And a little bit of inflation up top here. Unfortunately, the preserving fluid also gets in the way and prevents us from truly getting actual air. We end up just kind of infusing more fluid, but you can still see the inflation. 3, 2, 1. That's a little bit better. And I'm going to keep that there because I did get some. So you can see in the upper lobes we're getting some inflation. So 3, 2, 1. That's a little bit better. Just to get a feel for how the lungs actually inflate. And when you're breathing at rest, you're really only using about the lower third of your lungs. As you breathe deeper, you get to the upper 2/3. There's a good view of that. One more, and then we'll call it. There we go. We got some inflation there. Excellent. Okay, and that, my friends, is it for respiration.